My name is Dr. Ashley McClure, and today I'd like to share a surprising turn of events in our professional lives as physicians and nurses and all health professionals with you. What if I told you that the most powerful use of our medical expertise is not in providing direct medical care? What if there's an emergent use of our professional tools with the potential to save not just one life at a time, but multitudes of lives, both today and in the future? As I share a meaningful part of my own life story with you and reflect on our profession's history, I will show you our time-sensitive opportunity for heroic medicine. I chose to become a physician with the intention to promote health and heal illness. After having practiced primary care medicine for 7 years, our family welcomed a baby girl in November of 2018. During one of my young daughter's early fall naps, when I too should have been sleeping, I instead watched the documentary The Inconvenient Truth sequel. With the wide open heart of being a new mother, I watched Al Gore recount the scientific consensus on accelerating global warming and ecological collapse. Like many, I'd known all of these facts already, but becoming a mother gave me the courage to fully face the reality of our climate crisis. So with climate grief and concern in my heart, and concern for my daughters and all of our children's future smoldering in my heart, my climate call to action was lit when, by the infamous campfire, the deadliest and most destructive wildfire in California history. The fire that in fact, and perhaps in metaphor, destroyed Paradise, California. For the 13 days preceding the Thanksgiving Day rains, we in the Bay Area were enveloped by the smoke plume from the north. The air made carcinogenic and atherogenic from the smoke's toxic fine particulate matter. Like so many of us, I became a compulsive air quality index checker, monitoring not only our local levels, but also wandering the globe's air quality maps and realizing that in India and in China and other places, their local air pollution levels are always this bad. From the dirty coal-fired power plants and diesel and gas transportation fleets, whose greenhouse gas emissions are also fueling the climate crisis. So with my 5-month-old daughter on my hip, being tethered to an indoor air purifier, I had a nightmare preview of what our children's future will become if we do not immediately stop burning fossil fuels. We'll have sick, unbreathable air, unnatural disasters, magnitudes of avoidable human suffering that my direct medical care as a physician will be totally insufficient to treat. The cognitive dissonance was deafening. Suddenly, I could see no way to be the mother, the physician, or the person I want to be without becoming an agent for change. I couldn't keep living as if our fossil fuel-based business as usual style is acceptable, when the existential costs of today's climate inaction will be paid for through sickness and strife by our children and all those to come. So I had to figure out how to be part of solving the climate challenge. I took stock of my skills and my tools, and I asked myself, what do I, a primary care physician, have to offer the climate solutions, climate justice movement in order to protect everyone and everything I love? So physicians and nurses and all health professionals play a special role in society. In exchange for our dedication to human health and well-being, In pledges of beneficence and non-maleficence, we are given the profound privilege of social trust. With this privilege comes two unique gifts and responsibilities. First, we understand and respect science. Our late colleague, Dr. John Snow, the father of public health, showed how to put science to work to save lives by advocating for policies to address the root cause of disease. Even prior to widespread acceptance of germ theory, Dr. Snow studied the patterns of the cholera outbreak in London in the 1850s, and the evidence revealed that patients with dysentery were getting infected from a single well. And instead of treating each individual patient with clinical medicine alone, Dr. Snow realized the potential to save many more lives by closing the contaminated well itself. He successfully advocated to the London City Council to do so, and thus earned his title as the father of public health, practicing what I call heroic medicine back in 1854. So with this new policy, Dr. John Snow saved many more lives with upstream social advocacy for health to address the root cause of disease than his downstream clinical care ever could have. As physicians and nurses, we understand that neither the rates of exponential infectious disease contagiousness, whether cholera or COVID, nor the laws of physics determining the greenhouse effect from burning fossil fuels are negotiable. And with this understanding, we too can practice upstream heroic medicine with the climate crisis. So seemingly overnight, the world has come to understand the concept of flattening the curve in regard to COVID. The general public is talking about sheltering in place and wearing masks to protect loved ones and prevent overwhelming our medical system's capacity. As scientists, we understand that early action informed by science to flatten public health crisis curves, even when it's inconvenient for business as usual, that this saves lives. And this is as true for the climate crisis as it is for COVID, if not more so. We as physicians and nurses and all health professionals must flatten the climate curve by helping society to understand why, for our health, we must rapidly transition from dirty fossil fuel energy like coal, oil, and gas to clean, renewable energy that doesn't trap heat in our planet. Flattening the climate curve with urgent clean energy transitions is the only way to protect the lives of our children and grandchildren from overheating this precious planet. We're the first generation to feel the impacts of the climate crisis in our children's lungs with more asthma from worsening air pollution, in our parents' arteries with air pollution related heart attack and stroke risk, in our own sinuses with worse allergies, and in our psyches as we carry the climate grief for leaving a legacy of avoidable but catastrophic strife for our children. We are also the last generation to have the power to cancel climate apocalypse. By flattening the climate curve, by swiftly transitioning to clean energy, and preventing runaway tipping points to ecological collapse that will leave our children with deleterious air to breathe while trying to survive accelerating social strife fueled by food and water shortages and unnatural disasters. The COVID-19 crisis has brought our economy, our healthcare systems, and our societies to their knees. But even in light of the COVID-19 crisis, global warming poses a threat to humanity on a different scale. It threatens the livability of our entire planet for human beings forever. The climate crisis is an existential health crisis. The same dirty coal, oil, and gas that are destabilizing the Earth's climate are also contributing directly to poor health right now. Fossil fuel-related air pollution already kills an estimated 7 million people every year. Not surprisingly, people who live in more polluted places are also more likely to die from COVID-19 from the air pollution. Maps of air pollution reliably resemble maps of socioeconomic status, where the lower the income, the worse the air pollution. And now also the higher rates of COVID deaths. We call these frontline communities sacrifice zones. The Port of Oakland, where I work, is one. The COVID pandemic is an X-ray of society, exposing our deep socioeconomic and racial fractures that are predisposed by unjust social determinants of health and disease. And these social and environmental factors dwarf any of the ways in which actual healthcare determines health. No matter how excellently we provide healthcare, where our patients live and the air they breathe will trump our impact. And so, instead, we must address the most powerful social determinant of health we have ever known, which is the climate crisis. Conveniently, climate solutions provide immediate health co-benefits. In China, under the quarantine order to stay at home, fewer gas and diesel trucks were spewing exhaust pollution on the roads, and fewer coal power plants burning, and the air quickly got cleaner. And a Yale study found that more lives were saved from breathing cleaner quarantine air than were lost from COVID-19. And this brings me to our second and most critical contribution to the climate challenge, which is our uniquely trusted voice. This is our climate advocacy superpower. People know that we take a modern day version of the Hippocratic Oath, solemnly pledging to dedicate our life to the health and well-being of humanity, and that the well-being of our patients will be our first consideration. And these commitments bear the fruit of trust. When Americans are polled about what professions they trust, they rate nurses at number 1, we physicians a close second, and our pharmacist colleagues at number 3. This trust is perhaps the most critical tool in the climate solutions movement, because the public is faced with a constant onslaught of a profit-driven misinformation campaign about the climate crisis. Fossil fuel companies like Exxon have lavishly funded an expertly organized climate misinformation, climate denial campaign for the past 30 years. Somehow successfully making the greenhouse gas effect, that is physics, more politically charged than abortion. It's been impressive. Big Tobacco funded a similar misinformation campaign. And similarly, it took health advocates such as the former Surgeon General, Dr. C. Everett Koop, standing up to lobby profit interests in the interest of public health to help the public understand that cigarettes are deadly. And in the wake of the police killings of Black Americans like George Floyd, Breonna Taylor, Ahmaud Arbery, and too many others, many in our profession are powerfully leveraging our health voice in fighting for social justice, like in the White Coats for Black Lives movement. The fight for racial justice is tied inextricably to the fight for climate justice. As leader Hop Hopkins so clearly connects, you can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people. And you can't have disposable people without racism. So now, a step back, and I am going to return to my promise to share with you our collective opportunity as physicians and nurses and all health professionals for practicing heroic medicine. Every public health crisis brings the opportunity for heroic healers. Dr. Snow helped to cure the cholera epidemic with policy advocacy. Dr. Koop stood up to big tobacco. There's other examples. But we have a professional responsibility to safeguard health by using our uniquely trusted voice as a key to open the kingdom of public support for equitable climate policies to solve climate now. Health is a universally shared value. Evolution, thankfully, has ensured that everyone cares about their kids' welfare. Climate solutions have immediate and lasting health co-benefits. We must help bridge the political divide by centralizing these unifying concerns. We must connect the instinct to protect our children from visible threats to the invisible but existential threat of global warming. People trust us. No other professionals can play this role in determining the outcome of the climate story. A sage fourth-year medical student at UCSF, Dereck Paul, calls us to action, saying, when clinical medicine can't do any more to help your patient, but society can, social advocacy becomes the standard of care. And we're in an election year, arguably the most important election in human history. Our window of opportunity for meaningful climate action is closing. We cannot, and our children cannot, afford another 4 years of reckless disregard for science or quiet acceptance of climate inaction. The massive public investments of our COVID recovery must be used to build back better toward a healthier, greener, more equitable society. We must protect our children's future by jumpstarting the clean energy transition in earnest. And this starts with electing people who understand and prioritize solutions to the climate crisis. No matter what the party affiliation is of elected leaders, our collective fate requires that every elected official respects science and thus makes climate solutions the top priority in order to prevent runaway climate collapse. Thankfully, current polls show that the American public supports this. Climate change is one of the most important issues for the 2020 election. For many Democrats, climate change is the clear number 2 issue, second only to healthcare, and they're related. As trusted health leaders, we can and must further strengthen this growing public support across the proverbial aisle by framing the climate crisis as the health crisis that it is. Communications research shows that across varied audiences, framing climate as a public health issue rather than just an environmental one is the most likely messaging frame to elicit emotional reactions that are ready to support climate solutions. Our trusted health voices are critical to build the social will for acting on climate with the necessary urgency. Simply put, it's about our children's health, not just polar bears. Our trusted health voices are critical to build this social will. And In order for voters to be able to democratically express these historic levels of concern, we have to have safe and healthy elections this November. In April, Wisconsin proceeded with in-person primary election voting, despite warnings that doing so would pose huge risks related to COVID. Wisconsin officials forced their voters to choose between shielding themselves against COVID or exercising their fundamental right to vote. Predictably, the state experienced an election-related COVID surge and probably voter suppression. We cannot let Wisconsin's experience be repeated on the national stage. So, our first mission in practicing heroic medicine that I invite you to join me in for the climate challenge is medical community advocacy for a universal vote by mail option, supplemented by science-informed in-person voting practices in every county, in every state, in order to protect our most vulnerable patients and ensure a fair, safe, and inclusive election. History has its eyes on this challenging moment of multiple health and social crises. This November's election will determine the climate future that our children will face. As trusted physicians and nurses and all health professionals, we have the privilege of asking ourselves, which side of history do we want to be on? If Dr. Snow or Dr. Koop were alive today, I know they would tell us to use our trusted voices to advocate for fair, safe, and inclusive elections so that Americans can vote their support for urgent climate solutions in order to protect everyone and everything we love. Will you join me in practicing heroic medicine today by using your trusted voice to advocate for a safe election and to safeguard the potential for a safe and healthy future for our children? If you will, I invite you to, and there's opportunities and groups to join in the video description. Thank you.